Hey, you guys, this is Jordan. I'm the Community Engagement Coordinator with SHIP, which stands for the STD HIV Hepatitis Program. And we are starting a new segment called Quick Conversations, where we just talk about different topics related to sexual health so that you can be more comfortable with starting that conversation. Today, I would like to introduce who do we have. You can introduce yourself.
Hi, I'm Jan Mandani. I'm the teleprep navigator at SHIP, and yeah.
And today we're going to be talking about teleprep. So before we get into teleprep, Jan, could you tell me a little bit about what PrEP is?
Sure. So PrEP stands for pre-exposure prophylaxis, which essentially means pre-exposure prevention or preventative, like it's a protection before you're exposed to it. And PrEP is actually the method. The medication is called Truvada, and then there's another one called Descovy. But PrEP essentially means that anybody who is HIV negative and wants to remain HIV negative, but may be exposed or at risk of exposure to HIV, can take it to remain HIV negative.
So how often would you take this medication?
Everyone is supposed to be taking it every single day, but for it to be to start being the most efficient for men, or for people who are assigned men, they can take the medication for 3 days and it starts the protection to build up in their system. For people who are assigned female at birth, they would have to take it for at least 7 days before the protection starts.
Okay, cool. I'm glad you mentioned that because that was something I never thought about. So is there any side effects to PrEP? Is there anything that I need to keep in mind when taking PrEP?
I believe the statistics are it's about 20% of people who experience side effects. One of the more common ones are a stomach ache or stomach pains, and I believe dizziness and headache. But of all the people that I work with through the program, I don't think I've had anyone have a negative reaction to it. For the most part, people just are starting doing it, and it's fine.
Okay, cool. Thanks for that. I have heard about bone density. Is that a common thing, or should people be concerned about that?
Okay, so bone density loss bone density loss is a possible side effect for some people who are taking Truvada over time. It's a clinical aspect, so I don't want to speak too much on it, but I believe it only happens while the person is on PrEP. The possibility of bone density being lost normally only lasts while the person is taking PrEP. So I believe if the person switches to Descovy, the other drug, or maybe stops taking it, then the risk decreases again.
Oh, cool. Thanks for that intro into PrEP. What is teleprep?
Okay, so teleprep is a program that helps provide people with access to PrEP and in a virtual clinic. So essentially anybody in the state of Louisiana can contact the program and get on PrEP. So our clients, our patients, they'll fill out a form and we'll ask, how did you hear about us? And a lot of them have been saying either through a friend or somebody they know. When people do contact our program, I'll introduce myself. I'll kind of go over what PrEP is, ask them what they know about PrEP, and then we'll start the enrollment intake process. And that's we're filling out demographic forms, kind of getting the information. After that, I also tell them that they'll have to meet with a clinician first, who's going to send them to go get labs, and then after that, the labs will come back to us, make sure that everything is fine to start the medication, and then the patient gets PrEP.
Cool. So I could almost I'm literally avoiding going to the doctor initially, and I'm just starting everything online.
Yes, and also you can even get the lab test done at home, because we also do home mail-in kits. And we'll send it out to the patient. They just have to do it themselves and then send it back to the pre-filled envelope, and we'll get the results, and they can get it that way as well. So someone technically could stay at home the whole time and get sign up for PrEP.
That's really cool. So, because what I remember is, you still had to go in to get your blood work done. But what you're saying is now everything can be done at home.
Yes, the kits have a blood, there's like a little card and 4 circles. You put the bloods on it and they give you 2 lancets to prick your fingers.
That's really cool. That's pretty progressive.
Right.
So you can do it basically anywhere, even if you're in like somewhere that's like maybe like 2 hours from a clinic, you can still do the teleprep program.
Mm-hmm. Literally from anywhere in Louisiana. You want to know how people pay for PrEP?
I'm sorry?
You know how people pay for PrEP or how it's covered? Okay, so most of the people in our program is actually about 50% Medicaid and about 50% private insurance. People who have Medicaid, the prescription and the labs are covered essentially 100%, so they don't have to pay anything out of pocket. For people who have private insurance, the labs still have to figure out what the cost is based on what their insurance copay or co-insurance is. And then whatever that is usually whatever that leftover is that the patient has to pay for the medication. That's for labs. And then also if there's copays and deductibles for the prescription medication, because insurance doesn't cover it 100%, I will sign them up for a Gilead Advancing Access card because they have a program to provide people with a certain amount of money to cover their copays for the medication so that patients can afford it or can get it.
Nice. Mm-hmm. So what are some other frequently asked questions that people normally ask?
The thing is, when people call in, I know a lot of people are probably feeling shy about it. They don't have to disclose their sexual history. It doesn't really matter to us why they want to start taking PrEP. We're just glad that they're taking it, and then we ask them what they know about it so that moving forward, they know what the information is. Over that, there's not really a lot of frequently asked questions about the process. There might be more about like on the clinical side, but those are answered by our 2 clinicians.
Gotcha. So what is like, from your personal standpoint, what makes teleprep beneficial, or what makes PrEP beneficial?
So the thing about PrEP is that we say that it's basically like birth control. So like birth control, if you take it every single day, you eliminate the chance of you getting pregnant because it builds up a protection, or like it maintains a protection in your body, however birth control works. For PrEP, it's the same thing. As long as you're taking the medication daily, it builds up the protection in your system. And so even if you were exposed to somebody who has HIV, the chances of you contracting that is very low to none.
Cool. Mm-hmm. That sounds helpful. I'm trying to think if there's anything else that I missed.
Do you know who, what, when, where, who? So PrEP is for anybody who is HIV negative and wants to remain HIV negative. What is PrEP? I already went over that. Pre-exposure prophylaxis. Where they can access it from anywhere, from of course a smartphone or internet's needed for it, but they can access teleprep from anywhere in the state. What, where, when? Yes, the process for starting to get on PrEP, from enrollment and intake to receiving their medication, can be as little as 3 days, and that's allowing the patient to go and get their labs and then like come back, have the labs come back to us. And then sometimes it takes about 2 weeks, and that's when I have to like get back and forth information. But usually within about a week of contacting us, people can get on PrEP.
Nice. So PrEP, like being sent to their house?
Yes, it's mailed in. And even if their insurance is not something that covers it through our pharmacy, we'll work with outside insurance to make sure that the patient gets a prescription and they can just get it filled there.
Okay, thank you. And if anyone has any questions, like where can they go to find you, or if they wanted to get on teleprep, where could they go?
Well, if anybody wants to reach me, they can either give me a call or send me a text to our phone number, and it's 504-877-2464. It is the line's open from 8 a.m. to 5 p.m. And if you feel shy, we don't save phone numbers in our phone for confidentiality. So if you want to text, even just to ask about PrEP or how PrEP works, feel free to text us or text me. It's just text me.
Thank you so much, Jan, for your time. And again, if you all need any more resources and more information, please go to our website at www.louisianahealthhub.org or www.lahhub.org. I have to remember all the letters. But yes, please feel free to contact us or DM us if you want more information, or go back and text Jan. Thank you, Jan.
You're welcome.
Thank you all for starting a conversation with us. I hope you like this. This is our first video. Please comment and let us know how you feel about it. Talk to you later.